Hello everyone and welcome to the first liver pathology slide seminar on neoplastic and non-neoplastic diseases. I hope you will enjoy it, and I hope also you had access to the virtual slides on Crosscope. So now let's go directly to the first case. This is the case of multiple liver nodules in a 60-year-old male patient. So I must confess it is a really difficult case, but the slides were really nice and really typical, and that's why I included this case in the seminar. So now we'll go to the digital slide. So let's see this first case. So what is striking at low magnification is this blue dot, which I forgot to remove before scanning the slides, but I think everybody saw that in this biopsy there is two distinct areas, here. It seems like a non-tumoral liver, and even at low magnification we can see here areas that have a different appearance, and we will first take a look at the non-tumoral liver. You have here a big portal tract. Here you have the lobule. You can see that there is some minor inflammatory infiltrate, maybe also here iron deposits. When we go through this non-tumoral liver, also what we can see here is a portal tract with an inflammatory infiltrate. Also here some maybe macrophages with iron inflammatory infiltrate, but all these changes do not seem very specific and are likely to be related to what is near. And we now are going to look the other part of the biopsy here. So what we have here is necrosis of the lobule, and you can see here some hepatocytes that still can be identified, but there are a lot of areas where they have vanished. They have been they were necrotic, and you have here some sinusoid, the lumen of some sinusoids. And when you go through this area, you can see here large areas with no hepatocytes, completely necrotic areas. Here some hepatocytes with steatosis. And it was like this throughout this whole area. But here the most important thing to see, and that's why I wanted to include this case, because maybe it's easy to miss this diagnosis. The problem is not within the hepatocytes. The problem is what we see in the lumen of the vessels, of the sinusoids, like here, and also here. And when we take a closer look at these cells, you can see that they are highly atypical. Here. They look like hematopoietic cells. And when we continue to look at the biopsy, we can see a lot of these cells, atypical cells, here, with this dark nucleus. Here again, some cells, atypical cells with a large nucleus, large cells. And it was like this all the way. So what is important in this case is not to miss these cells. And I will now give their phenotype to you. So we perform some basic immunohistochemistry. I did not post the slides of immunohistochemistry because they were really easy to assess, but these cells were CD20 positive, CD79A positive, and this case is actually a case of intravascular B cell lymphoma. It's a very aggressive type of B cell lymphoma. So the clinical presentation was a little bit atypical, but really the histological aspect was really striking with these atypical cells that are mainly identified in the lumen of the sinusoids or the vessels.